Hello and welcome back to Focus Atlanta. Thank you so much for tuning in. In this segment, we are here with Dr. Kevin Dancy. We're going to talk a little bit about your dental care. Thank you so much for coming on the show.
Thanks for having me.
Now, it's prom season. There are a lot of special things kids want done around this time. What types of things are you seeing? What type of requests are you getting right now?
Well, it is prom season, and everyone wants that bright, beautiful smile for those pictures. So we're seeing a lot of people wanting bleaching and whitening and getting those teeth whiter and brighter.
Wow. Well, can kids do that? I mean, are your teeth still, growing or whatever? Is it okay for kids
It's
to?
okay in moderation. So we offer different types of bleaching. So there's the Zoom whitening system, where it's like the in-office bleaching. It takes about 45 minutes. We usually want people 18 years and older to go down that road. But yes, they are alternatives. You can have the gel strips, the bleaching strips. You can have the whitening trays, which a lot of people do, and always use a whitening toothpaste. So those are different types of ways that you can brighten those smiles.
Are there concerns though? Because you hear some people say, well, I don't want to use a whitening toothpaste, or I don't want to do that because my teeth might get extra sensitive. Should we be concerned about those things too?
Well, sensitivity is probably the main thing we see when it comes to bleaching. We suggest that people use fluoride before and after bleaching. That kind of protects the teeth from that sensitivity. But it is safe. I mean, the American Dental Association has done the research and condones the use of several different bleaching methods. So it's safe, nothing to worry about, nothing to really impact your overall health.
Have your patients told you that there's a difference, like from, are you a little less sensitive if you do the Zoom, or are you a little more sensitive if you do the trays? Does that matter at all?
Yeah,
what type?
It matters. It matters, how light one wants to become. The Zoom works so well because it takes 45 minutes and you will get as bright as you can possibly. The other methods take a little longer. So when you put something on your teeth that lasts, that may take 2 weeks before you see it, the bleach may be not as strong, but we're using it more often, so we see increased sensitivity with it. Doesn't mean that it doesn't work. It's just the 45 minutes versus 2 weeks or longer can increase the sensitivity of it.
Now, even for parents, when they're thinking about doing this for their kids, and even if they're doing it for themselves, if they go the Zoom route for the 18 and older, does most insurance cover our bleaching? Because that seems a little cosmetic.
It is usually cosmetic.
Okay.
Not necessarily covered by insurance.
Okay.
But at Great Expressions, we offer our own sort of smile protection plans for those people who don't have insurance. We don't say what we will and won't cover. There's a certain amount that we will cover for a calendar year, and that's a route to go for people who don't have insurance or who are looking to do other treatment.
Okay, so with the fluoride, doing the fluoride before and after your treatment, is that in our regular toothpaste, or you have to go get specific fluoride?
Yeah, I would.
Should have some pre-work done before the bleaching experience?
It is in your regular toothpaste, but I'm talking a little bit more.
Okay.
So I would consult with your dentist prior to doing any type of bleaching. If you do it in the office, or if you go somewhere else and buy something off in a store, still get that pre-fluoride treatment before you start. It helps tons when it comes to sensitivity.
Okay, and again, it is safe for our teens. They can have those nice, bright, smiles.
Yeah.
We just maybe want to do the ones that they take home in the trays.
Yeah, the trays are probably the best in terms of longevity, because you can, with the Zoom system, it lasts, and it may last a year, but depending on your habits, if you're a coffee drinker, tea drinker, wine drinker, or, well, I hope the prom people aren't drinking wine, but if you're right, but if you're an adult and you're drinking wine and your teeth stain more readily than not, then you'll always have those custom trays to go back to where you can reuse those. When it comes to the Zoom system, not so much. You have to go back in the office and do that procedure again.
Is that the same thing? You said there were custom trays, and then there's another kind of film?
Yeah, the white strips.
The white strips, you can do those again if you are a coffee drinker. Myself.
I'm right there with you.
Okay, good. All right, but that's something that now what is that process like? Should you do that only every 6 months, every 3 months?
Well, it depends on, everyone's different. When people look at themselves in the mirror and they kind of critique how their teeth used to be, how bright they used to be. When you see it not as bright as it was, then you can go ahead and do it. And the medicaments in the bleaching trays and strips aren't that heavy where you will see a drastic change quickly.
It's more gradual.
It's gradual. So you'll see those changes over time. In 2 weeks, you'll be right back where you were before you stop.
Well, Dr. Dancy, thanks for coming on the show.
Thanks for having me.
Can we close out the Great Expressions website or something where they can find their
Absolutely, greatexpressions.com. We are here to serve your full dental needs, so from kids to older, more seasoned patients. We take care of everything.
I appreciate your time.
Oh, thanks for having me.
All right, get those smiles nice, bright, and beautiful for prom season and graduation season. You know, you're going to want to take those graduation pictures too. And it's okay, it's safe for your kids. Have the opportunity, have the conversation with your dentist and see what might be the right option for you. Tune in for more Focus Atlanta. We'll be right back.